Hey guys, Dr. Christy Ennis. Today we are going to go over what causes this knee pain and how to get rid of it when you are doing your exercise. Now, there are three main causes that I see that typically cause pain for people when they're exercising. So let's start with the first one first. It's good to go in order, right? The most common thing I see is people doing incorrect form with an exercise or just truly the wrong exercise, okay? So, number one, the squat. A lot of times I'll see people doing this. They get the little hip thrust in there too, or they'll do this, okay? Or this. Now these are exaggerations, okay? But what that does, as you can certainly see with this one, is put more stress on the knee. When you're really forward, again, more stress on the knee. So a couple ways to correct that. I'm actually going to walk over to the wall. If you start by hanging on to a counter, something sturdy, and really think about sit those hips back so far that you can actually lift those toes up, this is a good way to start to get what the feel of it is. And then really think, squeeze those bunsies on the way up, okay? So we want to use those glutes. We don't want to use those quads. Those tend to be strong enough. Now, if that's still a problem for you, and I'm not saying you have to squat, okay? One of the other reasons that things get weak, or excuse me, that things are a problem is because of some weakness. We'll target that in a minute, but if you put a band around those knees, bring those feet apart a little, and then press out against that band in squat, you're now activating the glutes a little bit more, which puts way less pressure on those knees, okay? So this is an exercise that I'll have people do, and again, it's kind of like a potty walk, but you can always go back over to that wall. Using a chair sometimes too will help. If you think about, boop, got to put my butt in that chair. Obviously, if those still hurt, please don't do them, okay? The second exercise I see very often done incorrectly and with pain is a lunge, because this is what I see a lot. People go all the way down to the floor, or they make that knee go really far forward. So a couple things to help with that. One, stepping backwards actually causes a little less pressure. Two, you do not have to go down all the way. There's more force when you do that. And three, you don't have to let your knee go all the way forward, okay? So you might get, say, step back, come straight down, that back heel is up. As long as you can feel things activating, you've done what you need to do, okay? So get out of the habit of you have to be here. Sometimes we need to start here. It's okay to go down a little bit further too. Stepping back far enough and coming straight down, okay? Again, if this still hurts, please don't do it. The third exercise that I'm going to tell you right now, just please stop doing, is the leg extension machine. And I don't even have a picture of it because we have that nowhere in our studio. The most amount of force you can put on your knee in an open chain position, which is where your foot is not in contact with the ground, is full extension. Now, add a lot of weight to that, and lovely quads, right? But add a lot of weight to that with that machine, and you're getting a ton of force going through that knee. So if you have knee pain, odds are it's going to make your knee pain worse. Please get rid of those, okay? Obviously, squats and even lunges will help with the strength. I've got a whole video on great exercises to do too if you do have knee pain. I'll link that up above. All right, numero dos, whew, terrible language skills today, is, like I said, that hip. So when these muscles, specifically these side butt muscles, are weak, yes, not a sexy thing, right? This is what we see. Or that sexy walk, right? Oh, sexy girlfriend, but it's not good for the back or for the knee, right? So if these aren't working, I'm going to put more stress right in through here. So two super awesome exercises to work on that. We're going to go back over to the wall. I call this the sassy teenager because what you're going to do is drop, you can make that noise, drop a hip, and then you don't have to arch your back. Drop that hip. I usually raise my foot off the ground just a touch and hold on. Now you're using that left hip to pick that right leg right back up, right? So it's not here, it's squeeze and lift. Now if you put your hand here, you'll feel that, okay? 10 to 15 repetitions, and you'll probably be pretty darn tired. Don't lock that standing knee, okay? The other one that I love, and you can use the band if you want to, is this L form of the clamshell. So L because my body is making an L. My feetsies are together, They're going to stay together, and I'm going to lift that top knee up. Again, you're going to hopefully, and really should, feel that right here. I worked out today, so my legs are already a little shaky. Again, you can grab a band to make it a little bit more challenging. I usually say 15 to 20 reps, just to get some endurance going in those muscles too. I have no idea how many I've done because I'm a terrible counter, but you guys get the idea for sure, okay? So there's 2. We've got the form and we've got the hip strength. Now remember, and I'm pretty sure you guys probably know this, that the knee lies in between the ankle and the hip. That one's pretty apparent, right? Probably don't need to point that out. I do though, because if something's going on here, like we just showed, there's a problem in the knee. If something's going on in the foot and ankle, there also can take some force into the knee. One of the biggest things I see is when feet over pronate, right? So when that foot comes in, guess what? So does the knee. Now, sometimes it can be corrected just by strengthening up that hip, right? Which helps pull things open again, but not always. Every once in a while, you do need a little bit of corrective footwear or corrective inserts in the shoe. And it's really an awesome idea to get your gait analyzed. They make all sorts of sneakers, including motion control and stability. I usually start people in a stability before a motion control shoe. But you want to fix the hip first in case that rotation is coming in from that ankle. So again, get your gait checked out, okay? And make sure you're going to see somebody that really understands what you really need in that foot. And that can make a world of difference so that you're not putting pressure there. The other one that I commonly see is really a lot of tightness in that calf. When that calf is tight, the foot kind of gets stuck and it doesn't allow it to roll in and out the way it's supposed to, right? So because it's tight, it has to actually roll more this way in order to get over that foot. I'm just going to stand up really quick to show you that. So let's say my foot's tight. In order to move, because this isn't going to push off that way, I had to do this, right, to get that foot off the ground. So, doesn't feel good. Now, that means you want to loosen up those calf muscles, right? So we're going to grab that Derma Edge, do a little assessment of that calf. Oh my gosh, here's mine. And you're going to do a little bit of fascial work to get the blood flow going and those layers gliding. One of my favorite techniques to do is usually there's one spot that's worse than another. Take that little edge. I'm just going to bring my leg out. And you're going to move that foot up and down. So you're actively using the muscles to not only do a trigger point, but also to help with releasing that spot. And you do this until it feels a little bit better, okay? So there you have it. Start with the form, move on to that outer hip strength, and then if that doesn't solve it, move on to that lower leg with the foot and with the calf. Thanks, guys.